Hey everybody, it's Dr. Dave, Psychiatry. Thanks for coming to the YouTube channel today. Reminding you that if medication fixes your problem, that makes it a medical problem, not a mental problem. Hope that's encouraging to you. I get a lot of feedback that that's an encouraging statement. I was asked by a commenter on the channel to do a video on Lexapro. So haven't done a product specific in a while, so I'm doing that today. Sort of combined with Lexapro and Celexa, which was a medicine that came along that was invented in Europe. Celexa was invented in Europe back in the late 1990s. We used Celexa for a long time, and Celexa was then pretty much replaced by Lexapro in some ways, but it was a follow-on product. So to talk about Lexapro just for a second, and then we'll talk about that a little more of the history and how they're related. Lexapro, the long and short of it is, it's a very good, solid serotonin booster. So if your serotonin is low, if you're here with your serotonin and you need to be here, and the symptoms of low serotonin would be things like depressed mood, low energy, not concentrating well, not eating well, not sleeping well, feeling hopeless about stuff, the symptoms of depression, or the symptoms of generalized anxiety, feeling anxious, constantly under stress, not dealing with stress the way you feel you should, other people do. So chronic anxiety, generalized anxiety, and depression pretty much are the picture of low serotonin. So when you have that picture, oftentimes, as I teach on the channel, serotonin boosters are helpful for that. So the group of serotonin boosters, Prozac, Paxil, Celexa, Lexapro, Lexapro being the one we're talking about today, a strong serotonin booster to take you from here to here. Now, the dosing notches on Lexapro, typically I start at 10 milligrams. And within this category of medicines, the rule of thumb is one medication, one dose, 1 month. So Lexapro, I'd use 10 milligrams for a month typically. And if I needed to get more impact of the medicine, because amount does matter, you've probably seen that video too. If I need more impact, then we'll go to 20 after a month, and we'll go to 30 after another month. If I feel like I want to give the patient more time on 20 or 30, then we can go longer than a month. But obviously at 10, if they need more, then going to 20 is easy. Sometimes we'll wait 2 months instead of 1 month, but I'm comfortable making a decision with raising the Lexapro at 1 month, going from 10 to 20. 30 is about as high as we go. There's no demonstrated efficacy above 30, and insurance won't pay for above 30. So again, if 30 is not working, probably have used the amount that you need to test the key analogy. Have you used enough medicine? If you use the key notch of 10, 20, 30 and it doesn't open the lock, then you need a different key. So 30 is about as high as we go. Side effects, Lexapro has the typical side effects of the serotonin boosters. A lot of times Lexapro will cause the main side effects will be gastrointestinal. Again, that's because serotonin is made in your brain and made in your gut. So when you're using a strong serotonin booster, sometimes you'll get nausea, diarrhea, a little bit of irritating stuff like that. But for the most part, in my experience, Lexapro is very well tolerated. It's easy to take. It's once a day in the evening. Most people feel like Lexapro makes them sleepier as opposed to being a wake-up pill. So in contrast to Prozac, which we tell people to take in the morning, we tell people to take Lexapro in the evening. If you're the 1 in 100 patients that feels more awake on your Lexapro, certainly you can take it in the morning because the time of day doesn't matter. Once it's in your system, it is boosting your serotonin, and it takes typically at least 2 to 3 weeks to do anything. So it's important to not get impatient with Lexapro, to give it time to work. As far as the other concerns that we have with the antidepressants or the medicines that get called antidepressant that are serotonin boosters, there's still people that talk about medication causing suicidal ideation. Personally, I don't believe that medication causes suicidal ideation. I believe that depression, that this condition causes suicidal ideation. Sometimes that gets worse on medicines, but I don't believe that the medicine should be blamed. I think that's part of the inherent condition. Nevertheless, if you take Lexapro and you feel terribly worse in any way, you need to talk to your provider. And obviously the first step, if you're having a problem with it, would be to stop it, let your provider know, and take something else. As far as use with other medications, as a strong serotonin booster, it doesn't affect the norepinephrine system, so you can be on norepinephrine booster like Wellbutrin at the same time. You can be on a GABA booster like Xanax or Ativan or Valium at the same time. You can be on a dopamine suppressor to push down your dopamine at the same time if you're taking Abilify or Zyprexa, Seroquel, something like that. There are more technical videos which you can find on the internet. You can read the internet wiki, a Wikipedia page, if you want to read the detailed stuff that I don't provide here. But just really the core message is that it is a serotonin booster. It's a good serotonin booster. I use it all the time. It helps a lot of people. Historically, it's an interesting product because basically, from an organic chemistry standpoint, if you're not interested in organic chemistry, if that doesn't interest you, you can stop watching right now. But for people that that are interested in history, the medicine was invented prior to Lexapro, Lexapro is escitalopram. The medicine prior was known as citalopram, citalopram, citalopram. Well, citalopram, when you make it, it is a certain shape. And if you make the mirror image of it, it is technically a different medicine. So in organic chemistry, this is called a racemic isomer or an enantiomer. And basically the way to think of it is if you have a key that's shaped one this way, if you flip it over, it's the same key in mirror image, but it's not the same medicine. It's not the same key because it's in mirror image. So this phenomenon of an enantiomer is how they developed Lexapro out of citalopram. Well, you'll notice that the generic name for Lexapro is escitalopram. That's ES, and then the same word citalopram. Well, what does the ES stand for? Well, in organic chemistry, in the nomenclature, the left-hand image of a molecule is known as the sinister, the left, which is Latin for left, and the R, the right hand, is known as the R, or from the Latin rectus. So there's a left-hand image and a right-hand image. The right-hand image of citalopram is chemically different than the S sinister image of citalopram, thereby getting it the name escitalopram. They could have just put S-citalopram, which is what an organic chemist would do, but they actually just changed the name to ES-citalopram. So citalopram and escitalopram are literally mirror images of each other. What's interesting is that in the serotonin system where it works in your brain, apparently the way the lock is invented or created, however you look at it, the amount of citalopram that you need is basically it's about double. So the citalopram, the right-hand image, typically we start with 20 milligrams, we go to 40, 60, sometimes 80, whereas with Lexapro, we just go 10, 20, 30, and that's as high as we go because generally, chemically speaking, the S enantiomer, the S molecule, is over twice as potent in terms of how it functions with the lock. At least that's how I look at it, because obviously if we're dosing 20 milligrams of citalopram and 10 milligrams of escitalopram, Lexapro, that makes sense just from the math. So I think that's interesting because I had to take organic chemistry just to be a doctor, and this is one of the few times where we get to actually see organic chemistry and the racemic isomers in motion, in action. If that's interesting to you, I'm glad I said it. If it wasn't interesting to you, you already stopped watching the video moments ago. So anyhow, fun video today to make. I'm glad Lexapro is helping the person that actually comment. Like I say, it's great medicine, helps a lot of people. If you have tried it before, if you want to talk to your doctor about trying it, it's something that certainly would be a treatment option if you have the symptoms of low serotonin. That's all I'm going to talk about Lexapro today. And I'm Dr. Dave Psychiatry. Thanks for coming to see me.